David Liew here for Room Now, ACR 25, day 2, and there was a really fantastic RA abstracts, oral abstract session. A lot of fantastic work, some of which we'd heard a bit about before. Kevin Dean's work on hydroxychloroquine and stop RA, which unfortunately was negative. We heard from Andy Cope talking about the ALTO study, the continuation of Apipra, and the benefit that upfront abatacept can deliver in people with clinically suspect arthralgias and high ACPA titers. But in fact, one of the things that I think was particularly interesting that we hadn't heard much about in terms of the most recent results was actually data from Leeds presented by Tusk Toyota. And what he showed was looking at a cohort of people who had upfront TNF inhibitor for a year at the time of rheumatoid arthritis diagnosis. What effect could that have? I think a lot of us go through a process which has been reflected in the data up until now, where we start conventional synthetic DMARDs for the first period of time after a rheumatoid arthritis diagnosis and escalate up. But especially in places like the UK, we are getting the temptation to think about whether maybe upfront biologics might have an advantage, especially because with biosimilars, they are getting a lot cheaper. And if you come up with that upfront hit, whether you might have a legacy effect going on, especially thinking about whether we hit that difficult to treat rheumatoid arthritis, which we've become more and more conscious about. So that's exactly what this has looked at over greater than 10 years follow-up after an initial 1 year of TNF inhibitor. It's not a randomized trial. They've looked at a cohort that they've treated and compared it to controls from their clinics. But you can get an idea as to where the potential benefit is. So at 5 years, they saw that, in fact, that upfront TNF inhibitor treated group had less difficult to treat rheumatoid arthritis. We saw more remission at 10 years in that group as well. We saw that, in fact, more people had come off DMARDs altogether at 5 years, so drug-free remission in that TNF inhibitor upfront group. And we did see as well that actually the patients in that upfront TNF inhibitor group were slower to actually need a biologic later on. The median delay there was actually 11 months. And so it raises a question whether actually this might actually make sense from a cost point of view, as well as in terms of the clinical point of view. And in the UK, they are certainly focused on that. It did seem from these data that it would support a pharmacoeconomic benefit from giving an upfront TNF inhibitor. And with the cost of TNF inhibitors dropping down and down and down, the question will be, as biosimilars take hold, should we be giving a little upfront burst to try and get these patients to a better track than it would have otherwise been? It isn't quite enough to act on yet, but certainly raises some important questions that I'll bring back to the clinic and think about with my patients. For plenty more about rheumatoid arthritis, everything else at this magnificent conference, you know where to go, roomnow.com.